Good morning, everyone. I hope everyone is doing well. Welcome. I'm so excited to welcome you to the 2021 National Rural Health Day virtual celebration. My name is Kelly Calabria. I am the CEO and president of the Foundation for Health Leadership and Innovation, and I am thrilled to welcome each of you to today's event, where we will celebrate the power of rural North Carolina. As a native of Johnston County myself in the small town of Selma, I have witnessed firsthand the resiliency of those living and working in rural North Carolina, and I am honored to have the opportunity to be with you today. We have an outstanding program today which will highlight rural leaders, hometown heroes, and all those representing the important work being done in rural North Carolina. And I think it's easy to say a tremendous amount of work continues each day in our rural communities. Today is about lifting those stories and those leaders, seeing their work and learning from their efforts. So before we get started, I want to recognize our interpreter who is on today's conversation, Angie Schiavone. I'm going to turn it over to Angie, who's going to offer some instructions for those who would like to listen to the event in Spanish. Angie?
Yes, hello and good morning to everybody. My name is Angie and I'm here with my colleague Murtado. We're both with Full Circle Interpreting. And, in an effort to make this event as inclusive as possible and be able to include Spanish speaking folks, we're going to go ahead and interpret this whole session into Spanish. So please bear with me for just one moment while I explain these instructions briefly in Spanish. Hola, bienvenidos a todos. Estamos ofreciendo servicios de interpretación. Por favor, les recordamos que la forma de conectar a este servicio es encontrando el símbolo redondo de un icono que dice interpretación y luego se van para español. Si están en un teléfono o tableta, eso está ubicado abajo a mano derecha. Van a ver unos 3 puntitos. Presione esos 3 puntitos y luego se va a ir a español. Cualquier problema que tengan, por favor, nos dejan saber y que disfruten la conferencia. Thank you, Kelly. I've gone ahead and made the announcement in Spanish about interpreting services.
Wonderful. Thank you, Angie. I appreciate you doing that. And now I have the exciting honor to introduce to you my friend, Maggie Sauer. Maggie Sauer is our fearless leader leading the Office of Rural Health at the Department of Health and Human Services. She has been at the Office of Rural Health since June of 2017. And Maggie has a wonderful, outstanding career working with a variety of different nonprofit organizations. She was the Associate Executive Director of the North Carolina Medical Society Foundation for some time, directing programs to strengthen and expand primary care in North Carolina. She also held a position at Duke University working in the Division of Community Health, where she provided administrative management and coordination for 39 large and complex projects serving 67 North Carolina counties. But when I was talking to Maggie, the most important thing that she wanted me to make sure that I emphasized is her passion and deep love for rural communities. And while Maggie is originally a native of Colorado, she has called North Carolina home for more than 30 years, and her families have deep ties here in early history in North Carolina. She grew up on the rural eastern plains of Colorado and credits her childhood experiences for her passion to serve and work in rural communities. Maggie received her Master's of Health Administration from the University of North Carolina at Chapel Hill and her Master's of Science from Colorado State University. And Maggie, just on a personal note, thank you for your leadership during this time through this pandemic. You and your team have done an amazing job, and I will flip it to you to lead us forward.
Thank you, Kelly. It is such an incredible honor to be here with you today. And I think Donald has some slides that he will display for us. It is, as I said, Donald, I'm not sure that that's the right set of slides. I think it doesn't matter, but yeah, there's a different set of slides that maybe we could call up there. So we'll just stay on this one. Maybe Caroline can
We'll
sort
pull
of
that,
fill-
Maggie, while you start.
Okay.
Yeah.
All right. Thank you. Anyway, I just wanted to say what an incredible privilege it is to work with all of the partners, all of you who are here and part of this Rural Health Day event, and particularly acknowledging the partnership that's represented here today with the Foundation for Health Leadership and Innovation, with Hometown Strong, with the Rural Center, and really just such a grateful thanks. I mean, nothing happens, alone. And so, and I also want to say a huge shout out to the team at the Office of Rural Health. They love what they do. They love all of you. And it's just a real privilege to be the director of your Office of Rural Health. So I just wanted to say also that, this, if you look at the history of rural health in North Carolina, and Office of Rural Health in North Carolina is the first in the nation, but most importantly, it comes from a spirit of community. And Jim Bernstein, who was the founder, understood that Rural Health Day or rural health was really important to the United States and also in North Carolina. So guess what? 11 years ago, our national organization, the State Offices of Rural Health, said, you know what? We need to celebrate the people of rural communities who create health in the state of North Carolina for us, and really talk about the resiliency that resides in rural. So we have the pleasure to celebrate here today all of you who come together every day as resilient partners, whether you are in a church, whether you are a healthcare provider, whether you are a community member, a community health worker, whoever. We know that health is more than going to the doctor's office, right? So we know as a rural community that we look out for each other, we help get people to the doctor, and all of that. So it's really a celebration about each and every one of you. And so I hope today that if you are looking at the opportunity to promote Rural Health Day, that you'll use the handle Power of Rural, throughout the day and promote the good work, resiliency, and the really incredible work that rural communities do together. Next slide, please. So it really is, we want to showcase you. We want to showcase the work that you've done. It's been quite a year as we've moved forward, and you are the heroes. You've made the difference in your communities, and that's really what this day is all about. Next slide, please. And so a huge thank you to all of you for the work that you've done, and the way that you have created opportunities for all of us to come together during these times and to take care of your neighbors and your friends and the people around you. Next slide. One thing I would like to call out is a publication that the Rural Health Leadership Alliance created, and it's a really fabulous document. I really am so grateful for the foundation and their leadership in putting this forward. There are 30 indicators that are discussed within this snapshot. And it really is something that we all know that there are some pretty stark differences between rural and urban areas of this beautiful state of North Carolina. And some of those things you'll see highlighted is, as we know, affordable access to care, preventive care, dental disease, maternal health, food security, and premature death. And CDC guidelines and some of their rural statistics also have been focused on that in the past year. So thank you to FHLI and the partners who put this publication together. I believe it's available online for download too, right, Kelly? Okay, Great.
Yes, it is.
Next slide, please. And so, I think, again, our office spends a bit of time focusing, of course, on rural placement, recruitment of healthcare providers across the state. And one of the real stars in 2020 that we did not have a chance to celebrate, and we want to celebrate this morning, is Dr. Jeffrey VR. He is someone who has really dedicated himself to taking care and participating in rural communities, and it's difficult. The access to care in rural areas and helping rural communities with some of those issues around vaccine hesitancy and finding resources to help the community remain healthy has been a real challenge over the past year. He's one of those champions that basically has used his influence on multiple levels to create, health in the community. So he's at the rural health clinic and the hospital out at St. Luke's, which is in Polk County, provides care to retirement communities, substance abuse clinics, which has been such an important issue before the pandemic and certainly now. And it's been really difficult in rural areas for folks to get that kind of care. And then actually also the AHEC Rural Residency Program, where we talk about having people come to an area and hopefully be able to enjoy the community and decide that that's where they're going to make their homes. So I have the distinct pleasure of introducing a video with Governor Cooper. And I am so proud to say that our leader, Governor Cooper, is a rural guy. I think most of you know that, but he takes this very, very seriously. So I will let him speak for himself.
Hi, everybody. Governor Roy Cooper here. Welcome to the National Rural Health Day Conference. Thanks to the Office of Rural Health, Hometown Strong, the Rural Center, and the Foundation for Health Leadership and Innovation for your critical work helping rural communities thrive. The past 19 months have brought unprecedented challenges to our state. But even through these difficulties, we've seen the power of rural shine through. The teamwork and resilience of our rural areas have helped us make it through the pandemic. I grew up in Eastern North Carolina, and I'm proud to have more than 75 rural counties in our state. Every day, community leaders there are working to implement new ideas and bring solutions to challenges. The pandemic is shining a bright light on the critical need to expand healthcare access in our state. We must continue to work to ensure that every North Carolinian, no matter their zip code, has access to affordable, high-quality health care. Expanding Medicaid would provide coverage to more than 500,000 North Carolinians and boost our rural hospitals. And it's time to get that done. Thanks for being here today and recognizing the importance of rural health. The power of rural is strong. Thanks.
All right. So I think you can see that the governor truly is passionate about rural. And with that, I have the distinct pleasure of introducing Victor Armstrong. And Victor, I think one of the things among many that I'll use in your introduction that is so important is that your leadership at DHHS as the Chief Health Equity Officer is led from a place of authenticity and rural. I mean, you have a hometown in Plymouth, North Carolina, and no one understands better than you about the resiliency and some of the difficulties that come up in rural communities. So I'll give a little bit of an introduction here. So Victor came since October 1st, has been with us as a Chief Health Equity Officer. We're so lucky to have his leadership. And he has a responsibility for leading the overarching strategy and operational goals to promote health equity, diversity, and inclusion across all the agencies, health and human services. He is responsible for developing, implementing, facilitating, and embedding health equity strategic initiatives into every aspect of DHHS programs, services, actions, outcomes, and internal employee culture, as well as overseeing the Office of Health Equity, Office of Rural Health, and the Office of Diversity and Inclusion. And I will just say that he, if you can follow him on Twitter, which he has some great tweets that he puts out there. He's done some amazing TED Talks. And so I wanted to spend some time specifically outlining and paying attention to that initial part of the introduction, because this is it's a relatively new position in the department, and Victor takes this very, very seriously. So Victor came, he was part of the North Carolina Division of Mental Health, Disabilities, Developmental Disabilities, Substance Abuse. He came in March 2020, and he was responsible for public community-based mental health, intellectual and developmental disabilities, substance abuse, traumatic brain injury in North Carolina. And I think the other thing is important. He came to us also as after 6 years, president of the behavioral health with the behavioral health with Atrium Health, based in Charlotte, North Carolina. He had responsibility for operation of Atrium's largest behavioral health hospital. And so I think the most important thing here too is his 30 years of experience, his real understanding of behavioral health, resiliency, and most of all, because he's from a rural community. So with that, I'll turn it over to Victor Armstrong.
Thank you so much, Maggie. And I'm extremely proud and pleased to be here with you this morning. I'm also proud to be serving this state as its first ever Chief Health Equity Officer. And I think, as Maggie talked about, the fact that part of the Division of Health Equity is the Office of Rural Health, I think it just speaks to the understanding of this department and the recognition of this state of the importance of rural health. I did grow up in a small town of Plymouth in beautiful Washington County in northeastern North Carolina. I currently live in Charlotte and work in Raleigh, so I kind of split time between the two. But I didn't grow up in an urban area. I spent my childhood on dirt roads, and I spent my summers working in tobacco fields. And given my upbringing, I do understand both the richness and the challenges of life in a rural community as it pertains to achieving and maintaining health equity and a healthy lifestyle. I also understand that health equity only exists when people have, and by people, I mean all people, have the opportunity to attain their full health potential. And no one is disadvantaged because of their social position, where they live, or other socially determined circumstances. With systemic health and social inequities contributing to a lack of healthcare access and a growing mortality risk among rural Americans, the COVID-19 pandemic has further exacerbated health issues present in many of our rural counties. As rural communities are becoming more racially and ethnically diverse, minority groups that have had historically high rates of chronic conditions, including Blacks, Hispanics, and American Indians, are becoming increasingly exposed to compounded factors that may increase their likelihood of adverse health outcomes. In determining a rural community's vulnerability to COVID-19, the Center for Disease Control's Social Vulnerability Index looks at several variables, including housing, transportation, socioeconomic status, race and ethnicity, and language. And we've utilized this index, among other strategies, to help inform our response to the pandemic. In particular, assuring equitable access to the resources that both mitigate the pandemic and help us chart a path forward as we seek to eliminate health disparities within our state. We've adapted some strategies that I think have been effective in helping us to ensure equity, not only equity as it pertains to race and ethnicity, but also equity as it pertains to urban versus rural, equity for our elderly population, equity for veterans. And that includes going into communities and trying to establish trusted relationships with the state and relying on people in those communities who have that voice that people will listen to. And that includes going into our rural communities and building relationships with people familiar to those communities. It also includes increasing access to resources. We know that in many of our rural communities, there has not existed historically the infrastructure to connect people seamlessly to the needed resources that impact health outcomes. Going into those communities and trying to strategically make sure there's availability to testing and availability to vaccines has been a key part of our strategy for addressing the COVID pandemic. And then investing in those communities. We have a contract with NC Counts where we have invested in community business organizations to try to make sure we have boots on the ground working in those communities to be sure that we are utilizing familiar faces and voices in those communities to address the pandemic. And then Maggie and her team have been so effective in our community health worker initiative that is also a boots on the ground approach. And we intend to use that same kind of approach once we are in the recovery phase of this pandemic to ensure that we are being sensitive to the unique needs of our rural communities. As a result, 71% of North Carolinians have received at least one dose of a COVID-19 vaccine. That includes 69% of teens between the ages of 12 and 17. Children ages 5 to 11 can now receive a safe and effective COVID-19 vaccine. And the Food and Drug Administration has authorized a lower dose of the Pfizer COVID-19 vaccine for children in this age group. And the recommendation is for all children 5 to 11 to get the vaccine to protect against serious illness and help keep them healthy. And we are making every effort to assure access to the vaccine for all who wish to have themselves or their children vaccinated. National Rural Health Day falls on the third Thursday in November each year and recognizes the efforts of those serving the health needs of rural communities. In recognition of the unique challenges in our rural communities, North Carolina established the North Carolina Office of Rural Health 48 years ago. It was the first Office of Rural Health in the nation. And on this 11th anniversary of celebrating National Rural Health Day, we honor our hometown heroes and health professionals working tirelessly to provide local quality care for rural residents. These characteristics are more important than ever as COVID-19 heavily impacted the migrant farm worker community. COVID-19 cases in rural counties remain a significant concern and account for many deaths statewide compared to deaths in urban and suburban counties. Beginning in 2015, the National Organization of State Offices of Rural Health made a nationwide call for Community Star nominations, seeking individuals, organizations, and coalitions making a positive impact in rural communities. Dr. Gail Thomas, Medical Director of the North Carolina Farm Worker Health Program, has been named North Carolina's 2021 Community Star. Dr. Gail Thomas has been a Community Star her whole career, dedicated to serving underserved populations, including 22 years at a community health center. However, during the pandemic, Dr. Thomas worked every day since March of 2020 to champion the farm worker vaccination plan that vaccinated more than 27,000 farm workers with an acceptance rate over 96%. Dr. Thomas is the medical director of the North Carolina Farm Worker Health Program and UNC Department of Family Medicine Associate Professor. Dr. Thomas developed protocols and guidance to protect farm worker health outreach staff, establish new workflows, provide educational webinars for outreach staff and farmers to help them protect farm workers and provide appropriate and timely COVID response. Dr. Thomas has also served as a board member and chair of the board of the Migrant Clinicians Network, increasing her impact to a national level. Let us honor Dr. Thomas and her dedication by not only saying thank you, but modeling these amazing efforts in our own communities so that one day in every rural community, we may tell the stories of how COVID-19 taught us lessons of courage and the power of working together so that we can all live our fullest potential. Congratulations, Dr. Thomas, and thank you all so much.
Thank you so much, Victor. I really appreciate that introduction. I'm very moved. I am really honored to accept this on behalf of our outreach workers who are the heart of our program, and on behalf of my teammates and the Office of Rural Health, and on behalf of the over 70,000 men and women who work to grow our food in North Carolina. Donald, could you put my slides up? I am going to take this opportunity to talk a little bit about our program and about our COVID response and about farm workers in North Carolina. Next slide, please. So until I really became aware of farm workers, it was like a parallel universe that is always existed, but it's not something that I was particularly aware of until I did a rotation as a resident on the West Coast in Oregon in a farm worker community. But many of you might not know about farm workers, and why do they need a special program in the Office of Rural Health? And here are a few of the statistics that would answer that question. North Carolina farm workers actually make less than average farm worker income for the US. They make an average annual income of $11,000. And this is for working 6 days a week, often from sun up to sundown. They don't get any overtime pay. They get no paid time off to go to the doctor or for vacation. Agriculture is one of the most dangerous occupations in the United States, and I'm sure that all of you who work in rural healthcare are aware of that. 94% of farm workers have income at or below poverty level here in North Carolina. 90% are uninsured, and 90% are not comfortable speaking English. So that makes it quite clear how they are unable to access healthcare. In addition, many have unsafe living conditions, particularly living in very crowded work camps or barracks where there may be 6 men or more sleeping in a room. And these barracks or work camps have lots of pesticide contamination in the camp as well as when they're out in the field. These camps are intentionally hidden from public view and are isolated often at the end of dirt roads. Many farm workers, particularly those that are migrant who move for work, have no independent transportation. They're reliant on their employer to take them from their work camp to their fields during the day. And that makes it very hard for them to access any kind of health care when they need it. Next slide. This is the heart of our program. We have 8 sites where we train and support outreach workers. And the outreach workers are the real heroes. They are on the front lines. They are bilingual, bicultural people who understand how to reach farm workers. And in the upper left, you can see a couple of our outreach workers interacting with a farm worker at his camp. They help with health education. They help with interpretation when the farm worker needs to see a healthcare provider. They provide the transportation to the appointment, the interpretation at the appointment, and then the case management or the follow-up after the appointment. And without these outreach workers, I could sit in my clinic all day and not see a farm worker because they couldn't access me. But with the outreach workers there, talking to them, finding people who need health care and bringing them, these farm workers have a chance to receive health care. You can see that our federally funded sites really only reach 56 counties in North Carolina. And that's what our program looked like before the pandemic. Once the pandemic hit, we really needed to collaborate and reach all 100 counties. Next slide, please. This is a map of all the counties in North Carolina with all the farm worker health programs. And there are 12 additional programs in addition to the 8 that we support and fund. And we needed to immediately begin working much more closely than we ever had with our migrant health colleagues. Next slide, please. And this is a list of the migrant health centers in addition to ours. There still are counties in North Carolina that are not well covered by a migrant health program. And so there are still many, many farm workers who don't have the benefit of an outreach worker and don't have the benefit of a sliding scale fee or a safety net provider that they know and can go to. Next slide, please. We had to quickly change our focus from working with farm workers only to also working with all our agricultural partners in addition to farm workers. And this is just a brief list of the many partners that we were able to work with and are able to work with, and we hope we can continue to work with. And the pandemic has forged these relationships. So in addition to farm workers, we needed to be able to access growers because farm workers have so little agency, so little ability to affect their own health. We had to involve growers. We had to involve farm labor contractors. Farm labor contractors are companies who hire the farm workers and then will bring them to a grower. It's sort of a middleman. We were so fortunate to be able to forge relationships with NC State Agricultural Extension Services, and I'll expound on that relationship in a bit. Our colleagues in state government in the Department of Ag and Consumer Services have recently been able to get reimbursement from the legislators for isolation housing for growers that have COVID outbreaks on their farms. Our colleagues in the Department of Commerce and Ag Services were so helpful in helping us understand when and where migrant labor was going to arrive and how we needed to strategically position vaccines. Our colleagues in the Department of Labor are responsible for inspecting migrant housing and have been a big, big part of our ability to respond to outbreaks in labor camps. And then, of course, our closest colleagues in the Department of Health and Human Services have been so supportive in giving us an epidemiologist, giving us a consultant, and many, many other things that have allowed us to provide outbreak response and vaccinations. And then this relationship with the Agri-Medicine Institute has been a pillar of our response. They have been so helpful in reaching out to growers who are having outbreaks in their camps, in helping us to access growers with education, in providing internet connection for farm workers in farm worker housing, and also with reimbursement for isolation housing. You can imagine living in a camp with 50 to 100 guys. One person gets COVID. It spreads very, very quickly because there's no way to socially distance and there's no way to isolate yourself. And this has been a big challenge. Our outreach to employers has really depended on Agri-Medicine Institute in organizing and advertising among growers so that we were able to give webinars, so that we were able to give advice on how to deal with outbreaks in camps, able to give updates on vaccines. Early in the pandemic, the agricultural extension offices allowed us to distribute thousands and thousands of cloth masks and hand sanitizer to farm worker camps through the ag extension workers, which is very different than their usual work. Our colleagues in the Department of Labor were able to distribute materials in English and Spanish as they did their annual inspections of the migrant labor camps, which was so helpful. Through much support from DHHS, we were able to set up a vaccination hub and provide vaccines on arrival to a large number of farm workers, certainly not all, but a group of about 7,000 farm workers on arrival to North Carolina. And DHHS also helped us by providing interpreters for that. We were able to reach quickly employers and facilitate vaccinations as quickly as possible after arrival through local teams, which I will show you on the next slide. So this is a picture of Roberto Rosales, who is a health educator in the Ag Extension program. And he and his colleagues were able to create a vaccination education module, basically a large flip chart that went through common questions and concerns about vaccines. And this is a picture that he took at a training that he did on a farm. So this was one way that we were able to collaborate with agricultural extension. But the main thing was, because there are extension offices in every one of the 100 counties in North Carolina, we were able to take a little bit of time from one ag extension agent who had this job description added to them of anchoring a local team consisting of themselves, an outreach worker, and representatives from vaccine providers, which included our wonderful and very hardworking county health departments, our community health centers and migrant health centers. And by connecting these people, we were able to then facilitate getting vaccines quickly on a county level to arriving farm workers. And this was, I think, the key to the success in the vaccination effort. Next slide, I'll show you a little bit about our reception hub. So you can see this is a completely outside vaccination effort. And when you have 300 to 400 Spanish-speaking people who aren't able to pre-register and who need to get vaccines very, very quickly as they transition through this hub onto the farms that are waiting for them, it took a lot of help. And we were so grateful for the help, particularly of the community health workers from many local agencies, but especially Southeastern and El Centro. You can see we have a lot of water, juice, snacks. The men that were arriving at this hub had been on the bus for 70 hours coming from Monterrey, Mexico. And we wanted to make sure that they had something to eat or drink before they got their vaccine to help prevent them from getting dizzy or fainting or anything like that. And because of the strong support from DHHS and the state-supported vaccine vendors, we were able to provide about 27,000 vaccines in the state total, and through this hub, over 5,000 vaccines. And that has made a big difference. I'd like to show you the next slide. This is from our epidemiologist, Khalil Harbi. And the blue line is what we know about officially reported cases. You can see to the left, the blue line in 2020 was a lot higher than the blue line in 2021. We know that last year in 2020, there were many more cases than were represented on this chart. You all remember we didn't have adequate tests. Farm workers were not at all eager to get tested, nor did they have ability to access tests. So this is a big underrepresentation of what actually went on. The red lines, the red bars show the number of outbreaks. An outbreak is 2 or more documented COVID cases in a migrant camp. So there were many outbreaks, and there were many cases last year. This year, unfortunately, we've continued to have outbreaks, as you can see by the red bars, but they have been much smaller, thanks to the vaccination events that took place not only in that central hub, but in many counties, on farms, in local health departments, in community health centers, many mobile vaccination clinics going late at night to farms and on weekends, a lot of hard work of many people in the rural parts of our state made this successful. Unfortunately, we still have had deaths among our farm workers due to COVID this year, but many fewer cases thanks to these partners that were able to work with us. And my last slide is the names of my teammates who I am so grateful for. And not only this team here in Raleigh, but the outreach workers across the state who have worked tirelessly in this pandemic. Thank you.
Thank you, Dr. Thomas. I wish we were all in a room together so you could hear the resounding round of applause, because you see the little icons happening everywhere. I know I speak on behalf of everyone on the call and the people of North Carolina. Thank you for those really important words. Congratulations again. Your message was so powerful. And I think if I could be so bold, Dr. Thomas, the one thing I took a lot away from what you said, but one of the things I took away from your remarks is the power of collaboration in rural communities. It was a theme that you saw in everything that you brought together as the pandemic hit, of the folks on the ground and the communities just coming together and finding ways to make it happen. And that's so powerful.
Yes, I agree. It has been amazing, and we will need to continue to depend on each other.
Absolutely. Hopefully that's our silver lining from the pandemic, the power of working together. Well, I now have the wonderful privilege to introduce all of you to Caroline Collier. Caroline is wonderful. She is a part of the outstanding team at the Office of Rural Health. And Caroline has played just an instrumental role this year. If any of you join our rural coalition fighting COVID on a regular basis, Caroline has played such a big role in that this year, as we've worked to share information, but also connect with communities to receive information back. And so she's been a huge support in helping us do that through the department. So I'm going to turn it over to Caroline. She will lead us in the rural power pose. I know you're all excited to learn about that and help read the proclamation for today. Caroline, I'll flip it to you.
All right, well, thanks so much, Kelly. Dr. Thomas, congratulations. It's so inspiring to hear about your work. And I just love seeing everything that you're sharing. I love seeing the chat being active. And my role today is to kind of keep us being a little bit more active. As Victor Armstrong mentioned a few minutes ago, the third Thursday of every November is National Rural Health Day. And we were very fortunate to have Governor Cooper provide us with some words, but he's also proclaimed the third Thursday of 2021 as National Rural Health Day in North Carolina. And so in a few moments, we're going to have some community partners read the proclamation for us, which is very exciting. But as we do that, we wanted to spice it up a little bit. So if you have ever heard of power posing, I know Kelly mentioned that she had a boss who used to make her power pose before she went into an important meeting. So I'm going to ask that everybody be game right now and get up out of your chair if you can. You can turn your camera off if you want to, but we're going to do a rural power pose, and we're just going to embody the strength and power of rural while we read through the governor's proclamation. So if you don't know what power posing is, it's a quick and easy way to boost confidence and reduce anxiety. And some studies have shown that participants who power pose have physiological changes that build their confidence, make them more comfortable and assertive rather than reactive to stressful situations. So I'm going to show you 3 options, and I invite you to get up out of your chair. I'm going to have 1 option if you need to stay in your chair. But we're going to do power poses, and I invite you to please hold it while we have our guests read through the proclamation. So I'm going to get up out of my chair. And the first one is probably what's going to be most familiar to you, but it's just putting your hands on your hips. Your feet are about shoulder distance apart, and you're going to puff out your chest and look up to the sky. So this is our first one. A lot of people call this one Wonder Woman or Wonder Man. The next one is very similar to this. We're basically just going to change our arms and put them into our victory V. And you can have your arms or your hands either balled up in a fist or palms out, but your chest is still puffed out and your feet are still hips distance apart. And then the last one you can choose is if you want to stay seated, you can put your hands behind your head, elbows out wide, and then just take one leg and cross it across your knee. And basically we're just taking up a lot of space while we're doing this. So we're working on confidence. I personally like the Wonder Woman pose. And I'm sorry I'm tall, so I'm a little cut off. But powerful leaders don't just think a certain way, they carry themselves a certain way. And so we're going to embody that while we listen to the proclamation being read. So I'm going to ask that Donald pull up the proclamation and our guests read it for us.
Whereas the state of North Carolina has many rural communities that represent the rich and diverse background of our citizens. And
whereas rural communities are fueled by the creative energy of their citizens, always willing to step forward, share and implement a vision, and drive change that benefits everyone. And
whereas meeting the healthcare needs of citizens is constantly evolving as rural communities face unique challenges and propose unique solutions. And
whereas rural healthcare providers create tremendous opportunities to deliver more comprehensive, compassionate, patient-centered, and holistic care to rural communities in collaboration with rural hospitals. And
whereas the rural healthcare system is an economic foundation of their communities, and whereas the state of North Carolina joins the North Carolina Department of Health and Human Services and the North Carolina Office of Rural Health, along with other interested agencies and organizations, in recognizing the unique healthcare needs and opportunities that exist in rural communities.
Now, therefore, I, Roy Cooper, Governor of the State of North Carolina, do hereby proclaim November 18th, 2021 as National Rural Health Day in North Carolina and commend its observance to all citizens.
I had to scoot back up to the table. Congratulations. That was very good. Thank you, Caroline, for leading us through that wonderful proclamation and getting us out of our chairs and remembering the power. I did used to have a boss who made me do that before. I thought she was a little crazy, but it actually works. So I'm glad we did that together. All right, let's keep moving on. And I am so excited for the next section of our agenda because we are going to hear from two amazing women who are serving their communities and truly are on the front lines of this pandemic day in and day out. They are no question our hometown heroes. And so I have the honor of introducing to you Miss Patricia Peel and Miss Lauren Brown. And I'm going to give you a little overview of an introduction of both of them. And then I'm going to turn it over to Miss Peel, who's going to share some insights of what she has learned in her community through the pandemic. So since 2002, Ms. Peel has served as the Health Education and Outreach Coordinator at Rural Health Group in Roanoke Rapids, where she organizes, secures funding for, and directs a 28-member healthcare coalition. She also plans and manages a health disparities initiative for a medical network in 6 counties in northeastern North Carolina. Prior to her work at the Rural Health Group, Ms. Peel worked with the North Carolina Cooperative Extension first as an extension agent and later as the county extension director. Ms. Peel has served as a member and chair of the Halifax County Board of Health, a member of Rural Health Group Board of Directors, founder and senior consultant of Roanoke Valley Breast Cancer Coalition, a member of the Halifax County Human Relations, and a member of the Beaufort County Board of Education. Ms. Peel has a Bachelor's of Science from Bennett College in Greensboro and a Master's of Education from East Carolina University. She is also a Rural Economic Development Institute graduate and from NC State University, and she has received a nonprofit management certificate from Duke University. Thank you, Ms. Peel, for being here today. We're so excited to hear from you. And I'm also going to introduce Ms. Lauren Brown. Lauren, we're so excited to have you as well. Lauren serves as a social clinical research program manager for the Julius Chambers Biomedical Biotechnology Research Institute at North Carolina Central University. She is responsible for managing North Carolina Central's Advanced Center for COVID-19 related disparities. She performs statistical and epidemiological analysis of data and acts as a liaison with other agencies on collaborations for disease prevention and health intervention activities. Lauren is a graduate from North Carolina State University with a bachelor's degree in biological science, and she received her master's of public health from the University of North Carolina at Charlotte. And I love this, Lauren. She says her goal as a public health professional is to promote health equity by examining ways to minimize health disparities. So as you can see, we are very fortunate to have these two ladies as our hometown heroes. And Ms. Peel, I'd love to come to you first. And I think what we are hoping to hear is really your experiences over almost these 2 years, getting close to 2 years through the pandemic, and what you've seen in your community, and maybe some insights that we could learn from the work that you've led. Oh wait, you're muted, Ms. Peel. We can.
Okay, can you hear me?
Yes, thank you.
Thank you so much, and thank you for having me. And I am delighted to be here to represent my area of the state in North Carolina, northeastern North Carolina. And we refer to the area where I live as the Roanoke Valley. And so we have a lot of distinctive identities that are assigned to us because of our health outcomes and the situation that exists in our area. But I want to tell you as a person who is on the ground and working with our local healthcare organizations, I have a perspective that allows me to be able to share maybe some information that we can all consider when looking at community engagement. I work with the Rural Health Group. It's a federally qualified healthcare center, and it covers 6 counties in northeastern North Carolina. So when I was assigned the job as outreach coordinator, it was very difficult to understand how I was to cover 6 counties and make a difference with our health outcomes. We started out doing breast cancer awareness, and then we changed from that to now, in the past couple of years, we have gone to COVID. We have a program that we work in with our coalition. We formed a coalition in order to be able to do the work. And that was with our local hospital. And we formed the Roanoke Valley Breast Cancer Coalition. But our goal was to improve our overall health outcomes in northeastern North Carolina. Rural Health Group had a goal of going to above the bottom 20 in health outcomes. Well, and I looked at the statistics, we were 99 out of 100 counties in the state. So that gave us something to work towards and to kind of focus on an agenda that would give us some impacts as well as help the people in our community. So we formed this coalition. I also like to mention the fact that a part of the coalition was expanding or bringing in our churches, community organizations, other groups, but I am a member of a HBCU sorority. And I understood that sororities have a mission in community service as well. And so we engaged all of those groups, sororities, fraternities, orders of Eastern Star Masonic groups, and all of those to see if they had a mission or a goal towards healthcare that could be merged with us in order to create a shared vision for how we were going to move forward in our community. And opportunities were afforded us also through our partnerships with the universities and with foundations that were, of course, looking for opportunities to do community engagement so that we could address this issue of COVID-19. We took on a project with the CDC Foundation, and we called it the PIE Project. And that was because we were partnering. We knew that that was important to partner. You cannot do it as one organization. I don't care what the situation is. It's overpowering to deal with healthcare in a whole broad situation. So we needed to partner. We also needed to inform our citizens of threats or the conditions or the situations, whatever they needed to help them to be able to feel confident in the information that we were distributing. And then also the E was to empower. We say that because there are a lot of people in our rural areas and communities that are not healthcare professionals, that are not degree professionals, but communicate in their communities in a way that people respect them. And we want to identify those folks, get them into a program where they can learn whatever they need to learn to give out the information that's important to address the issue. So we were doing wonderful work by engaging all of these folks. We had a Bay Health Advisor training program, and we continued to do that each year. And we're still continuing to have a training and updating our lay health advisors. We are their back office, and we send them out in the community to do talks, demonstrations, support groups, to give out reading materials, games, demonstrations, promotional products, educational displays, fundraisers and walks, church announcements, and community events. But we tell them we're your back office. So feel confident to go out and distribute the information, but know that we're right behind you. And if you need anything, any other information or research-based information, you can turn to us and we're here for you. And so we empower them in that way to be able to be confident to go out and help those in families and communities, churches, or whatever all around in the community. Then we also engaged in another program to address, we are looking at social determinants of health. At the same time, we're dealing with a pandemic. And so you're mounting up all of these concerns, and we're needing to address them. So our coalition determined that we needed to create a shared vision and allow every organization to utilize whatever resources they had and to address those issues that they needed to address to satisfy their funders, but to also know that we wanted to move the needle and make an impact in our community, such that when the grant is expired and all of the deliverables are done, then what? Where are we? How do we continue? So what we decided was we were going to put together a group. We call it the Community Fellows. And we train them with a curriculum that was developed out of North Carolina A&T State University that is so appropriate for dealing with people at the community level in a way that they can understand. I had been an agricultural or cooperative extension agent, so I knew of the program and used that information. It identifies with people who live in projects, who live in housing areas, senior citizen centers, and all of those places. They have as leaders, but they are not recognized as leaders. So we decided we could provide training for emerging and existing leaders to come together and to create a shared vision for how we were going to move forward and provide some sustainability. Here we have access to information from our providers and our wonderful academic partners, founders and foundations. And we have all of this information, but we really need to be able to get it into communities. And so we were working on, we even did billboards, and we highlighted the local people in the communities on those billboards, so that when people ride down the street and see them, they know, oh, they recognize someone, pay attention to it rather than just a graphic. So we had photo shoots, and especially involving African-American males, who people don't recognize as a force and leadership group in our community. But we engaged them in photo shoots, and we did that. We gave out COVID bags, and we assisted with getting people to the sites to get their vaccines. And these community level groups were very helpful in doing that. So now we have a real strong community engagement model in our community that encompasses just about every aspect of our community in our effort to help get people vaccinated. But not only that, because that's the issue right now, but we really do want to raise our overall health outcomes. Mm-hmm. We are now at 95, we were at 99, and we're at 95 and coming up. Those are the kind of outcomes and impacts that we want to see, not just activities and things in our community. How can we really make a difference? We don't want to be that a disadvantaged area. Right. We want to be a part of the state of North Carolina. And as such, we want to have as much opportunity for healthcare and all of the services that people have in the city areas, urban areas. And it's up to us, but we are trying to work very diligently to put together our force in our communities so that we can have sustained growth and outcomes over a period of time, not just incremental. And so I'm proud to be part of the Rural Health Group, Roanoke Valley Breast Cancer Coalition, and all of our partners, UNC, AACRT, National Institute of Health, CDC Foundation, all of those. But we are focusing on our community, and we are proud to be able to do the work that we do. I'm sorry I didn't know to prepare slides.
No, this was what we needed, Ms. Peel.
I have many of those.
Yeah.
But I was just giving you an overview of what we've done in terms of changing our goal, our outcome. Yes. we really want to see some significant impacts. And so it's not just a matter of projects over people, it's people over projects.
Well, I think that last sentence sums everything up of what I hope everyone on this call takes away today, Ms. Peel. I really hope everyone was listening to your words and to the point about building a community engagement model that puts the community at the center, that we're not just assuming we know what to do in a community, that we're listening, and you really are guiding us on how to be better at doing that. And I think your point about working to drive real change and not just putting Band-Aids over problems is just a point we all have to take away. So thank you so much for sharing that and being comfortable going through all of that with us. We're very fortunate to hear your message this morning. So thank you. I really appreciate it. And let me go to Lauren. Lauren, we're running a little short on time. It's been a full morning, but I do want to come to you with your work that you've been doing through Central University, and maybe just share a little with us about what you've seen and what you've been doing looking at the data in your projects.
Is it fine if I share my?
Yes, absolutely.
Oh, it says it's disabled.
Oh, sorry. Donald, can we give Lauren sharing rights, please? Hosting rights. All right, are we there? Work?
Yes.
Awesome. Thank you, Donald.
Let me just. Okay. So good morning, everyone. So I'll be talking about the North Carolina Central University Advanced Center for COVID-related Disparities. So I wanted to start off by providing some background as to what really motivated the start of this program. So the COVID-19 pandemic has really exposed and amplified various social economic inequalities and health disparities, especially in underserved communities. It's also been proven that COVID-19 testing and vaccinations are very effective strategies at combating the spread of this disease. And so underserved communities such as rural communities often experience limited access to healthcare, which can include testing and vaccinations. This can be due to various barriers such as lack of transportation or even a distrust of healthcare organizations. So as the Accord team really wanted to aim to increase these opportunities to testing and vaccinations for this community. So going into a little bit more detail about just our vision and what our goals really were, we really just wanted to be able to examine some of the challenges and the impacts, both public health related or economic related, that COVID-19 really had on the underserved communities of North Carolina. So we wanted to be able to encourage and support increased testing. We also wanted to support many projects that other researchers had that were related to COVID-19 disparities. And we also recognized that for different racial and ethnic groups, we wanted to be able to develop and spread culturally sensitive messaging to COVID-19, just because we recognize that messaging is so important, especially with spreading information. So these were the rural counties that we were the most active in. So you had Granville, Vance, Warren, Halifax, and Anson. We also did some work in some of the rural areas in counties that might be considered more suburban, such as Rowan County or Cabarrus County. And so as a lot of speakers before me have mentioned, collaboration is just such a big priority when it comes to this type of work. And so we worked with multiple organizations, and that includes local health departments, different faith organizations such as churches and other nonprofits. But a big part of our collaboration process was identifying different community facilitators for each county. So these community facilitators were individuals that were very active in their local communities. So that could mean that they worked with their local churches, or that they already had worked with different nonprofits, or they might have had their own initiatives that they were doing. Our goal was to create a community-based effort, because we recognize that our university is located in Durham. So we would be considered an outside organization to a lot of these communities that we're going into. And so there can be distrust towards outside organizations coming in to these communities and kind of saying what they know best. We really wanted to make sure that individuals and organizations that were already active in these communities really led the charge in our program. And so, for example, we had a community facilitator in Anson that she would know a church, or she would know a soup kitchen that was running. And so she was able to say, hey, we can combine a testing event with a food drive or a clothes drive that's already going on in the area. Or she can identify different individuals that she already is connected to in the community to be able to engage and say, okay, hey, we need for this part of the county, it would be really useful, we could get a testing site set up or a vaccination site set up. And so because we had these community facilitators, I think that's what really pushed the success of the program, is that they were able to be really the kind of face of our program to their communities. And they were able to really advocate for what the challenges were for their specific communities. And so just to talk a little about the results. So we've had over 75 testing events held in general, and about half of those were held in rural counties. So again, these events were held, it could be after a church service where people can literally leave church service and we are set up right there in the parking lot, or it could have been in conjunction with the local health departments that already were having different events. And we were able to test over 4,500 individuals. And we were also successful at developing culturally sensitive messaging, whether it be, the messaging could be in English or Spanish, or really be tuned into the challenges that different communities were facing. And so on the data side of things, we were handing out surveys at our testing events for people to just kind of talk about or report their thoughts or how they've been impacted by COVID. So I just kind of shared some of the statistics that we were able to collect. So this is based off of the participants that we asked about internet access. And so about half of our respondents lived in rural counties. Out of those respondents, 82% were African American, 61% reported having internet access. Through our research, we know that internet access can really affect how people receive information, or that could also create challenges for them to receive information about testing. So you have to be aware of how that could provide a challenge as well. And we also saw that 40% of our participants in rural counties reported difficulty in paying monthly bills. So we kind of saw a little bit about how people had been impacted economically as well. And so just to conclude my presentation, again, collaboration was just really what we saw was really key to how we were able to make an impact as an organization. And so, again, I just want to say thank you so much for allowing me to be able to present on the Accord project. And I'm really honored that I could participate in celebrating National Rural Health Day. Thank you.
Lauren, thank you so much. And I know I speak for everyone on here that this is just incredible work, and your presentation was so helpful. I love the theme that we're pulling through here around collaboration, but I also heard, Lauren, you raise another point that I think is really important, and that's the notion of trust in community. You can't fake that, right? Like you have to find those ways to partner and be authentic. And I think that was really important in your message. So thank you for sharing that. And thank you for being here today. We are running close on time, but we have an exciting way to close this out. I'm going to flip it over to my colleague, Lisa Tyndall, who's a member of the FHLI team, and she's going to lead us quickly through a word cloud exercise that I think you're going to really enjoy. So Lisa, let me flip it to you.
Sure. Thank you, Kelly. Can you guys see the question?
Yes.
Okay, awesome. So just a little instruction first before we get started and punch it into your phones. You have two ways to join this poll, which is going to culminate in what we call a word cloud to kind of summarize how everyone has felt about or defining rural North Carolina over the last year. So if it's easier for you to use your phone, then you pretend that this number is a person and start a message to that number, and it's 22333. So that's the number that you type in to start a message, and then you text Amelia Muse, which is my supervisor, 529 to that number, and that kind of lets you into the poll. So you're texting Amelia Muse 529 22 to the number 22333, or you can join on your computer, pollev.com/Amelia Muse 529. And these instructions, for those of you like myself who need things written down, are at the top of the screen. But the question is, what is one word? What one word would you use to define rural North Carolina over the last year? And what's happening, as you can see the screen, is that as you all are typing words, the bigger words are the words that more people are typing. So you're seeing kind of that word resilient, which I think is very appropriate, is coming through nice and strong, as is diverse. And these are the words that people are really sharing. Innovative. Community is huge. It just popped up. I wonder, I don't know. And collaboration. Yep. And we want to give it a minute or two, because you can see how much it changes as people type in their thoughts. And you can certainly type in more than one word. We have around 60 some participants still with us. And so we really want to make it, give as much opportunity as possible. And the good news I heard just right before this is that we are going to share this Wordle. I call it a Wordle, sorry. A Wordle. Like a Wordle. Yeah, word cloud, Wordle. We're going to share this with you afterwards. So I just want to give it a chance. I see family up there, unbreakable, connected, strong, phenomenal, authenticity, connected, I said, a strong, responsiveness. Amazing.
I saw undefeated. That's pretty amazing. I love that.
It's really, this might be one of the biggest ones I've ever seen, which is great. A lot of words are coming to people's mind, but there are definitely themes here. We'll give it like 30 seconds more. Proud.
Proud.
Perseverance. It's funny because just when I start reading a word, it changes. All right, so maybe let it keep going, Kelly, and then shift to your, while you're
absolutely, Lisa. Thank you for leading us through that, and I hope you enjoy doing that. And it's fun to see the words come on the screen. I do think all of you will agree that today has been a powerful, uplifting celebration. During the pandemic, the power of rural was and continues to be illustrated over and over as communities across the state work together to provide much needed resources for their neighbors, such as housing, food, and transportation. And I know we shared a lot of words on the screen, and that's really important, but I hope when you leave here today that I could encourage you to think of and remember 4 words. So I'm going to tell you, and there's an easy way to remember it. We can call it our 4 R's. And so those 4 R's are resiliency, relationship, readiness, and responsiveness. These words are so important because they recognize and celebrate that communities themselves understand their own challenges better than anyone. Each day, community leaders are hard at work implementing new ideas and driving solutions. Communities in rural North Carolina are proud. We know that. Many of us are from those communities. There are no question that they are resilient. And they look to all of us as leaders to be authentic, to show up, to be responsive, and to take time to build a relationship, exactly what they should expect from all of us. It is also true that a significant number of African Americans, Native Americans, and Latinx individuals live in rural North Carolina communities. Before and especially throughout the pandemic, health equity has been a top priority for historically marginalized populations. Our partners in the state remain focused and committed to improving health equity. You heard that this morning from Victor in his remarks amongst historically marginalized populations. It is important work that we must continue, and I know all of you agree. I want to thank you for joining us. I salute our hometown heroes. I really appreciate everyone being here. We are going to put a link in the chat to the coalition landing page, the North Carolina Coalition Fighting COVID. We will continue to have events. And so please check out this landing page so that you can receive that information and begin to make connections with other leaders across the state. So we thank you for your time. Don't forget to use the hashtag. Maggie, what's the hashtag that you want all of us to use? A reminder. Is she there? The power of rural. Remember to use it as you're posting throughout the day. We really appreciate it, everyone. There it is, power of rural. Thanks, everybody. Have a wonderful day, and thank you for joining.